Hello, I'm Dr. Ian Strawford. I'm a cosmetic and wellness doctor, and I'm the medical director of Skin Excellence Clinics. Do you suffer with, and you could be a man or a woman, but you're suffering with hooded eyelids, where your eyelid skin is coming right down and almost getting down to where the eyelashes are, and that makes you look really tired and run down? Or are you a woman who's really hating the fact that you can no longer apply any eyelid makeup on anymore because the skin's so loose and wrinkly in that area? And you might be thinking, what do I do about this? How do I go about it? Who do I see? Do I need surgery? What are the issues? Well, at Skin Excellence Clinic, we've got many, many years of experience where we can help you make the right decision to how best to treat upper eyelid hooding and eyelid skin laxity.
Is surgery the best option for hooded eyelids?
So a lot of people ask me, and a lot of people come to the clinic with hooded eyelids, and unfortunately the only treatment that's really going to offer them a good and long-term solution is surgery. And this is surgery which is called the upper eyelid blepharoplasty, which is where a surgeon, usually a plastic surgeon, can carefully take away the excess skin, usually done under local anesthetic as a day case. So it's quite a simple operation. And really in those patients where they have advanced aging of the upper eyelid with quite significant hooding, then surgery, yes, is really the best option in those cases.
What are the non-surgical options for hooded eyelids?
So a lot of patients that I see who have hooded eyelids are probably either fearful or scared of having surgery, and they're looking for a non-surgical solution. So how do I guide them as to whether a non-surgical solution is the best or not? So really, we need to ascertain the degree of laxity. So in the early stages of eyelid hooding, which could be in your 30s or 40s or even early 50s, then the non-surgical approach of tightening the skin of the eyelids can work quite nicely. I find that we've used treatments such as plasma treatment, where we're literally fractionally burning the skin of the eyelid and getting it to contract and rejuvenate in a tighter, nicer skin. Can be a nice, effective way of tightening the skin. But more latterly, we've used other more gentler treatments such as Tixel, which is a heat treatment applied to the eyelid skin to cause a contraction and a rejuvenation of the skin. And I've found that actually if we pre-treat the eyelid skin with polynucleotides, which are these RNA fragments from fish sperm DNA, which is injected into the skin a few weeks before we do an eyelid tightening treatment, then we get a much better response to the eyelid tightening treatment. The bottom line, though, with non-surgical eyelid tightening is that you do need more than one treatment, perhaps 3 or 4 treatments to get a good degree of eyelid tightening. And the results from that treatment may last a year or so. So you do need to have maintenance treatments to maintain that eyelid tightening. So the decision really comes down to the degree of tightening and the age that you're presenting with your upper eyelid hooding. And we can help you make the decision as to whether non-surgical or surgical is going to be the best approach for you. Certainly, when you've had surgery, or if you've had surgery to the upper eyelids, it isn't permanent, and there will be an ongoing aging of the upper eyelid skin. And you might start to notice the results of surgery deteriorating after 2 or 3 or 4 years. And it's really appropriate then to consider non-surgical treatments such as Tixel or even plasma to maintain the results of a surgical blepharoplasty. So we're often treating both patients non-surgically and those patients who've had previous eyelid surgery to maintain the results.
What treatments can prevent or slow down the development of hooded eyelids?
So a lot of patients are coming now in a younger age group, maybe in their 30s and 40s, who are worried that they're developing upper eyelid hooding. And certainly they may see that quite significant hooding in their parents and are fearful that they're heading in the same direction. So I often get asked the question, can I do anything now to slow down the process? And the answer is definitely yes. So when we look at the upper eyelid hooding and what causes it, there are 2 factors. The first factor, which is really important, is the brow position, because the lower the brow is, the heavier the brow, then the heavier the skin above the eye will be. That's one thing we can prevent. The second is actually the skin of the eyelid skin itself aging and becoming more lax. So when we look at the brow position, the biggest thing we can influence there is the muscles, i.e. the frowning muscles that we all have, pulling the brow down, and that will get stronger and pull the brow down more with age. So Botox into the forehead, into specifically the frowning area and around the eyes for the lateral part of the brow, can allow the brow to naturally elevate. And this is really important because I see a lot of patients who are regularly having Botox into the forehead to treat lines and wrinkles that are actually exacerbating the brow drop of age, i.e. they're treating the muscle that lifts the brows and they are accelerating the aging process. So for me, it's actually getting patients to stop having their Botox in the forehead, causing the brow to drop, and just treating the frown area and around the eyes to elevate the brows. So a lot of my younger patients, that is how we treat it, to maintain a much nicer elevated brow position, which lifts and tightens the skin of the upper eyelid. The other thing they can do is actually slowing down the aging of the eyelid skin, protecting it from the sun 100%. That's really important. But equally, we can use things like polynucleotides injected into the eyelid skin, these DNA fragments from salmon or fish sperm, very effective, or PRP injected to the eyelids, LED phototherapy. These are all lots of stimulatory regenerative treatments which we're using to maintain the health and the quality of the eyelid skin.
Can Botox make hooded eyelids worse?
Definitely Botox done incorrectly can make hooded eyelids worse. Not only that, they can make your expression look more tired and run down and hungry looking by dropping your eyebrows. So there's a lot of people doing Botox out there, many of them not even properly medically qualified, who are treating people with Botox, primarily just trying to reduce lines and wrinkles across the forehead, but with really a very poor understanding of the anatomy and the aging process of our upper face. So the frown muscles pull the brow down, and the lifting muscle called frontalis lifts the brow. So in my experience, if you treat the frown muscle, but not the frontalis muscle, then you'll get a natural lift of the eyebrows. And so that is the best way of maintaining an elevated eyebrow position, as well as preventing and slowing down the development of hooded eyelids. So it's really important, if you're having Botox or if you're not having Botox, that you see a qualified practitioner, preferably a doctor or a nurse who's experienced with Botox and knows the aging process and the anatomy of your face to be able to treat you effectively and to slow down the aging process, not accelerate it.
I'm worried about developing hooded eyelids. When should I consider having treatment?
So I'm increasingly getting a lot of patients coming into clinic in their 30s and 40s who are worried about developing hooded eyelids. And I think for these patients, it is appropriate to start treatment early. And from this, my first line of attack is usually to suggest that they have Botox to elevate the eyebrows. And I say to elevate the eyebrows and lift that heavy skin or the development of the heavy skin, because that will get worse if the brow comes down. And so importantly, having Botox to lift the brows, and not, as I see with many people doing Botox now, dropping the brows and accelerating the aging process by doing that. Also, rejuvenative and stimulatory regenerative treatments of the eyelid skin. This can be simply using a very effective topical skin serum on the eyelids that we have. LED phototherapy can help the eyelid skin, and polynucleotides or PRP injected into the eyelid skin, possibly even using the Tixel treatments, which is thermomechanical ablation, a simple heat treatment, very safe, done with local anesthetic, to the eyelid skin can be very effective, started early in age to rejuvenate and restore a health of the eyelid skin.